My personal history with psychedelics actually started before I was even born. My mom, who is my biggest inspiration and my hero in life, spent the decade leading up to my birth following around the Grateful Dead on tour. Which, for those of you who aren't familiar with the Grateful Dead, they were essentially a traveling musical hotbed of psychedelic activity. My mom actually wrote an entire book detailing her experiences on the road with the Dead. A book that culminates in her getting arrested for selling LSD and serving time in prison for it. Shortly after she got out, my mom got pregnant with me, and she put the nomadic deadhead lifestyle behind her so she could focus on being a parent, which, by the way, she did an awesome job with. Thank you for everything, Mom. I love you. But the point here being that my mom had a rich and deep relationship with psychedelics, and she was always pretty candid about those experiences with me. Just to be clear, my mom wasn't giving me psychedelics as a kid or anything, but she always took the time to answer my questions in a way that was transparent and true to her life experiences. I was actually a teenager when I started experimenting with hallucinogens myself. And in the years since then, I've had a series of adventures with LSD and magic mushrooms and a few other substances, ranging from the absurd to the profound. And over time, my personal relationship with these drugs has evolved, as has our culture's view on them. Recently, there's been a big push towards the decriminalization of certain psychedelics, such as psilocybin, which is the active ingredient in magic mushrooms. Seattle is one of many places that recently took this step, and now people are talking about how psychedelics could be used as a tool for addiction therapy, or how they could potentially help with things like depression or anxiety. I think that this is a super interesting topic, and I wanted to learn more about what psychedelic research actually looks like these days. So I reached out to today's guest, Nathan Sackett, who's an assistant professor at the University of Washington and is currently leading their psychedelic therapy trials, making him the perfect person to sit down with to help bridge the gap between your average enthusiast like myself and somebody who actually works in the field. I thought this conversation was really informative. I hope you get something out of it too. Enjoy. We are rolling.
Cool.
Thank you so much for joining me here today.
My pleasure. Of course.
It's really exciting. I'm looking forward to having this conversation. For those watching, I am sitting here with Nathan Sackett, who is according to the internet, assistant professor. Is that accurate? As well as a researcher at University of Washington, and a lead on the psychedelic research at UW.
I'm helping to develop a research program in psychedelics at the university. Yeah.
That's so interesting, and I want to get all into it.
Sweet.
But to start off, could you just tell me about your background? Are you from Seattle? Did you move here? And how did you become interested in psychedelic research?
Sure. So my background, I'm from California, from Northern California. I lived in San Francisco for about 15 years, where I was first a nurse. I worked predominantly in hospice nursing. I did that for a couple of years, then went back to school and went to medical school at UCSF and graduate school at UC Berkeley, and then moved up to Seattle for my psychiatry training in adult psychiatry up at in 2016, I guess. And then I did a addiction psychiatry fellowship here at the university, and then came on as faculty. So I'm fairly new to the area and still getting acclimated, I guess.
Cool. Well, welcome. Glad
Thanks.
to have you here. So what is it specifically that got you interested in the psychedelic side of research, and how does it tie into your background in terms of, you were saying, like therapy and like addiction counseling?
Mm-hmm. So let's see. My interest in psychedelics has been long-standing. I always joke that my best psychedelic credentials come from the fact that I went to UC Santa Cruz as an undergrad. I've always been interested in altered states of consciousness. I've always found altered states to be super fascinating. I think that's what led me to want to work with addictions as well, because ultimately I think we're all seeking altered states in different ways. Just some are more problematic than others. Regarding psychedelics, my interest really peaked and it evolved from my just personal interest into like my professional interest about halfway through my psychiatry residency training. It was in like 2017, late 2016. There was just a bunch of research that had come out of Johns Hopkins and the East Coast about psychedelics, and specifically looking at things like psilocybin for depression. And there was a couple small pilot studies looking at psilocybin for tobacco use and psilocybin for alcohol use. And I think I was at a point in my training where I was just feeling really I was feeling a little bit frustrated with the treatments that we have available and wishing that we had other things to provide for patients. And so I started going down the rabbit hole and doing as much reading as I possibly could, and was really impressed at the research and impressed at the data that I saw. And I thought, well, gosh, this is something that we should be doing here at the university. And so I went to my chair and tried to figure out how to get involved. And he said, well, it's not going to happen. It's too controversial. And so I basically just kept harassing him. And then here we are a couple of years later. Now we're developing a center. We're calling it the Center for Novel Therapeutics and Addiction Psychiatry. It's a mouthful. But it's essentially a research center at the university focusing on how we can better use psychedelics from a therapeutic perspective to treat substance use disorders. So that's kind of the quick overview of how I ended up in this spot.
I mean, that's amazing. And I think anyone who has had experience with psychedelics sees the potential for how it can help people and heal people.
Yeah.
But figuring out what that actually looks like in practice is kind of one of the things I want to get into here.
Totally.
'Cause I feel like there's a big gap between, like, I hear about a study or they prove, maybe microdosing or macrodosing or something, has beneficial results. And it's like, yeah, I mean, that plays into the bias I have, where I think these things are great. But it's like, what did that study actually look like? So could you kind of paint a picture for me of, like, just in, like, do you start with actual trials with people, or are there steps you have to take before you can do that? And what does it actually look like when you start working with people?
Yeah, no, that's a good question. So in large part, before you can do any clinical trials on humans, there has to be a bunch of animal model work first, so that a lot of mice and rats basically get drugged. And so that work has been done at a lot of different universities throughout the world. And so we're now in a phase where it's generally accepted that it's safe to work in humans. And so from a practical perspective, you're right. The current state of kind of the social excitement right now, I would say, far exceeds the actual scientific evidence that we have right now. I mean, I like you, share a bias in that I think there's a great potential for psychedelics to do a lot of good, but we still have a tremendous amount of unanswered questions, and answering those questions is going to take a long time. It's going to take a lot of money. It's going to take a lot of energy. And one of the challenges we face is that, at our current state right now, with psilocybin and a lot of the psychedelics being studied, they're considered Schedule 1 compounds. So there's no federal funds available for this. So this all has to be privately funded. So that's a big barrier. But before I go into that, I guess to answer your original question around what does it look like from a practical perspective? So I can tell you, I'm working on a clinical trial right now. And so essentially, we do a series of preparatory sessions with patients. Once patients are enrolled for the specific criteria that we agree on, we do a series of what we call preparatory sessions, where it essentially looks like therapy, except there's two therapists, and then there's the participant. And a lot of it is discussing, what's the specific issue at hand. Let's say it's depression. Talk about their history of depression, what it looks like, how it presents. And then over, you may have a couple of meetings that look just like therapy, and you kind of talk about what the experience may look like. And so then on the day of the dosing, you again have two therapists and then the participant. You sit in a room with them, you give them the medicine. And then at that point, it's really you're just observing. You're not really doing a lot of therapy at that point, right? You're really encouraging people to go inwards, to kind of sit with their feelings. You're there as more of a witness, if you will. Like you're there to kind of, be empathic, be a presence, be supportive. We're taking a lot of notes. If there's any like epiphanies that someone has, you can write it down. And then after the medicine session, then you have what are called integration sessions, which again look just like therapy sessions, except you're now trying to make meaning of that experience that they had. Ideally, people when they have the medicine session, is often what we call it. It can be a transformative experience. It can be really life-shattering. It can be an opportunity for people to see themselves and their life from a different angle that they don't normally have. One of the things about psychiatric disease, whether it be addiction or depression, is that your world becomes smaller and smaller and smaller and smaller. And you start to see the world through this very constricted lens. And I think what psychedelics have the opportunity to do is to really widen that again and allow people to see things from a bigger perspective. So in that same vein, when you're doing the research, when you're doing the integration sessions after the medicine session, you're helping them and try to pull them through that experience and guide them a little bit around, like, look, there are these experiences that you can still have. You can still feel joy. You can still feel love. You can still feel, wonder and awe. Um, does that answer your question a little bit about the logistics?
Yeah, it really kind of gives me something to go off of what this actually looks like in practice, which it's, I mean, it's one of those things where you think about like studies and you think about like labs and test tubes, like that kind of seems like the opposite of like the shamanic like healing experience, So it's interesting to hear kind of where these worlds can collide
Yes.
in that sense. When you're doing a practice like that, how do you go about like finding the people that are going to be involved?
Yeah, that's a good question. So, like any study, you generally, you have to, there's a huge regulatory burden of you have to like get approval from the university and kind of the ethics board. And so it depends on what patient population you want to study. But for example, I'm currently trying to develop a study for tobacco users. And so my recruitment will be at, tobacco cessation clinics, primary care clinics, around the hospital, around the university. I'll put up flyers, and then there's a screening process. You have to define what characteristics you want in the patient population that you want to study. And so I want like young, healthy people who don't have a lot of other issues, right? And so that's your inclusion and exclusion criteria. And so then you screen them, and then you get a sense of whether or not they're a good fit for this study. And that's a difficult process, like figuring out what your patient population that you're trying to recruit is and how that matches to the patient population that you want to generalize to is like a whole field in itself, and it can be challenging. And to your prior point around like the lab versus like the shamanistic experience, this is a huge issue of like, how do you translate? I mean, for example, the last place that if I were to do psychedelics, the last place I would ever want to do them is like in a hospital setting.
Exactly.
Like it seems like that seems like a challenging experience, right?
Yeah.
And I can appreciate that we are not at the stage right now where we're able to take participants into the woods, which in the ideal world, I would take people into the woods and be in nature. That's for me where I feel like psychedelics have the most power is in the natural world. But unfortunately, for a lot of complex reasons, we're not quite there yet. And so we do have to do it indoors. And so that often requires like, we often tell people to put eye shades on, we put on music, we try to like block out the senses around, so it doesn't feel like you're in a hospital,
Yeah.
But it is a conflict. I mean, I certainly feel that myself.
Interesting. It's something I've always wondered is like, is that something that the people involved in this research are thinking about? And are they trying to cater the environments to like somewhat like, I don't know, find that balance? So it's interesting to hear that you're doing kind of the isolation tank strategy where you let them like go into it. How do you figure out dosage when you're doing something like this? Even as like recreationally doing it, figuring out what dosage you're trying to do, unless you have had like a steady source from the same batch, it can be very difficult.
It can be very difficult.
How do you figure out what you want to test, what amount you want to test, and then how do you actually make sure it's consistent?
So for research purposes, there are actually labs that synthetically derive. So for example, I'm on a trial right now looking at psilocybin. And psilocybin, the mushroom, if you give the whole mushroom, there's all kinds of things in there. There's baeocystin and norbaeocystin, and there's all kinds of compounds in there that we don't actually fully appreciate or understand. What we do know is that the active ingredient that's most psychedelically active is psilocin. And so psilocin can be synthetically derived. So to do research on this, we don't just give people full mushrooms because that's too complicated kind of pharmacologically. I mean, I hope actually, to that point, I hope that we actually are able to do that at some point in the near future. But right now, we're not there. Right now, when we give people psilocin, it has to be from an FDA-approved lab. And so there's a lab that basically provides all of this. They provide psilocin to all of the research projects going on across the country. So it's all like a standardized amount. In terms of dosing, there was a good amount of data that was derived from the 60s and from the 50s, 60s, and 70s. And so both from recreational users and from that early data, we can generally approximate what the dose should be for kind of a macro dose, if you will.
Yeah.
Yeah, but there's some controversy about that too, about what exactly is a macrodose, and but right now the kind of agreed amount number for psilocin is 25 milligrams, which is thought to be equivalent to a fairly good sized macrodose of whole mushrooms.
Is psilocin different than psilocybin?
So psilocybin is the prodrug, which just means that it is metabolized in your body to psilocin. So psilocin is like that's what actually crosses into the blood-brain barrier and actually has the impact.
Gotcha.
Yeah.
So when you're approaching, like you want to do a study like this, uh, how did you decide to take the macrodosing approach versus microdosing? Like in general, like you were saying, there's so much more, I guess, enthusiasm around the subject than there is real data. So how do you figure out which angle to approach it first? Because there's so many different things it feels like you'd want to test.
Absolutely.
How do you figure out what's the most important thing to start with?
So that's a very good question. I mean, as with any research question, right? I think the first step is you figure out what's been done out there. And so a lot of this is derived from the data from the 50s and 60s. And there actually is a fair amount of data from that time period where macrodoses were used. And so a lot of it is just kind of the natural extension of the data that we have available. Microdosing is interesting because I'm not sure how I feel about microdosing. I think that there's probably, I mean, I suspect there's a benefit to it. But I personally believe that that part of the therapeutic potential is in the experience itself, is in having that kind of intense emotional, ego dissolution, whatever you want to call it, however you want to frame it, spiritual experience, whatever. I think there's some value in that. And so for me personally, I'm interested in studies that are going to pursue getting people to that point, right? And I think I certainly think there's value in microdosing, and I think that it's worth looking into. Unfortunately, at the point we're at right now, because the data is so young, we don't have a lot of preliminary data to make a case to start doing microdosing studies at this point. I mean, hopefully that'll change soon, I hope. But to answer your original question, we essentially have a small amount of data that has shown that macrodoses have some effect. And so we kind of have to extend that and continue that research through before we can kind of pivot into looking at things like, microdosing or more specific dosing paradigms.
So when we talk about like the existing body of research that is out there on this topic, and a lot of it was done back when it feels like they weren't being as rigorous about what you can and can't do, like especially you hear about the tests, with the LSD trials in the 60s and 50s, and you're like, wow, they actually just did that. So we're building upon that kind of stuff. So two questions here. One is, what does the existing research say about like psychedelic use in therapeutics? And then the second is, what steps do we take? Because like from an outsider perspective, it seems like the first step in terms of like trying to popularize these methods is the research. So if you're saying, well, we're not at the point where we can like research microdosing, what steps need to be taken before you guys would get to the point where it's like, oh, now this is something we can explore?
Yeah, so there's a couple. So let me back up to the first question.
Sorry for dumping all.
No, it's okay. It's okay. Sorry, what was the first part of the question again?
First question was the existing body of
the existing. All right. I wanted to comment on that. So you're right. A lot of the early data, a lot of the early studies were very poor quality, but there's a reason for that. When psychedelics were first being explored, to get access to the psychedelics from the pharmaceutical company, to get what was called Delicid, which was early LSD from Sandoz Pharmacy, you had to publish your data. So a lot of the early reports were not actually meant to be rigorous clinical trials. They were people who had small private practices who wanted to use this in their patients, but to get access to the drug, they had to publish it. And so that led to, poor quality studies, some of which were certainly unethical. I'm not defending a lot of the studies because some of them were not well done. But there is a lot of observational data from that time period that we can kind of build off of. So that was the first point I wanted to make. The second point around, how do you pivot? Like I think that, kind of you're asking like how, at what point can we move the research into things like microdosing?
Yeah, if like the macrodosing research is built on stuff that maybe we couldn't do now,
Yeah,
how do we get back to that level with something like microdosing?
totally. That's a very good question. So in general, what needs to be generally established is like safety. So oftentimes what will first happen is there'll be studies done on animals just to test like if I give them a microdose, will it kill them or not, right? That's like the simplest first pass. And then once you can demonstrate, oh, this is not going to kill them, then you can start to get into questions of feasibility. Like, does it do something? Does it do something that we want, right? And so then you have to design studies using animal models often, to show some sort of change, whether that be using imaging techniques or behavioral techniques. There has to be some like cause and effect that you have to demonstrate. Then you can do pilot studies in humans, where you then essentially replicate the work you did in animals for safety, and you say, okay, I'm going to take 10 healthy volunteers and I'm going to give them a microdose, and does it do anything to them? I'm going to check their blood pressure. I'm going to check blood work. I'm going to do all these tests just to make sure it's not harmful. And then once you do that, then you do the same thing. You try to replicate. You try to show some sort of action, by doing a little bit larger of a trial, maybe 25 people, and you try to show that maybe it reduces cravings, or I'm an addiction psychiatrist, so I'm interested in how can they be used to treat addiction. So then I might take a group of smokers, give them a psychedelic, and afterwards ask them, has this changed your cravings? Does this change your motivation to quit? Right? Then you can do a larger randomized control trial, like a kind of the gold standard, and do a bigger trial. But as you can probably appreciate, each of those steps is like, it's like careers, right?
Yeah.
It's like years and years and years of lots of work to try to like slowly move the needle forward. And the reality is those projects each take, insane amounts of money. And without any federal financing for that, the research is slowed way, way down. And so this is a huge issue that we're coming up against, is funding, right? All this takes a tremendous amount of money. And so, yeah, so to your point of how do you pivot into something like microdose? Well, with enough money and enough motivation, it can happen, but it just takes an incredible amount of organization and an incredible amount of effort and a big risk. These are people's careers, and it's hard to get people to like put themselves out there for unknown outcomes.
Yeah. So with this current stage of moving the needle and your current trial that you're working on at UW, what's the particular, I guess, hypothesis, or what's the current way that you're what's the current lesson you're trying to learn?
Well, I think so. I have a couple of different trials that I'm working on. But I can speak more globally about the center, right? What my hope is right now, as I said earlier, there's so much enthusiasm about psychedelics for good reason. I think there's a tremendous opportunity, and yet we don't really know what's the best patient population for these compounds. I'm particularly interested in how can we use psychedelic assisted psychotherapy for substance use disorders. And so how do we best pair, what psychedelic paired with what psychotherapy? There's all these different forms of psychotherapy. And so maybe something like cognitive behavioral therapy would go better with psilocybin, whereas perhaps something like acceptance and commitment therapy would go better with LSD. We just don't know. So the questions that I'm really interested in asking are, what psychedelic mixed with what psychotherapy is best indicated for what patient population? So that's like the high level question that I'm trying to ask. Now, as you can appreciate, that those questions are huge, and will take me, I will probably not be able to answer those in my lifetime, right? But to do that, I am trying to develop a series of different clinical trials to start to chip away at that, and to try to create collaborative relationships with universities and research organizations throughout the region to try to like move this forward. But it's gonna take time.
In terms of that being the big goal, if one of the bricks is like learning how psilocybin, works, another brick is figuring out how LSD works and figuring out how they all go together. Which bricks do we already have some understanding of? Is there some where are we in terms of our current understanding?
Yeah, that's a good question. So if the question is around where are we in our current understanding of psychedelics at large, I would say of the pie, we have a tiny sliver of understanding and it's pretty small. But then if we zoom in on that little sliver, I would say most of that sliver right now is composed of probably psilocybin, MDMA, and ketamine are probably the three that we know the most about. And LSD is up there as well. I would say those four. We have a good understanding of how they work. I mean, good understanding. I should say that with very loose terms. We have some sense of how these compounds work from a safety perspective, from a potential therapeutic perspective. We have some sense of how they could be used in other applications. But there's still like so many unanswered questions. There's a lot of other compounds I'd like to study. I want to study like ayahuasca. I want to study ibogaine. I want to study salvia. I mean, there's so many other compounds out there that I think have potential. But but right now I would say I have to focus on the little information we have is probably on psilocybin, LSD, ketamine, and MDMA. And so that's kind of where we have to focus right now. I hope to expand to other compounds. There's a lot of interesting data to suggest that ibogaine is really helpful for opiate use disorder. And as you can appreciate, with opiate use disorder being a huge issue, like anything that could help reduce some of that suffering seems like a giant leap forward.
Absolutely. How long does a trial usually go on for? I'm sure this is also related to the budget, but I'd be curious. Are you just trying to get the short term, like immediate after effects of like one of these therapy sessions, or are you following them for year after year and checking in with them to see if there's like lasting effects?
Yeah, so you're right. So the big constraint there is finances. So the studies that I'm working on right now, most of them have a pretty short follow-up, a couple of months at most. But ideally, as we can develop the infrastructure to do this research more thoughtfully, we'll do things more longitudinally and we'll be able to follow people over a series of, 6 months, 12 months, 24 months. That would be ideal. But yeah, it is that is a hard thing to do financially.
How are therapists trained when it comes to things like bad trips and just generally talking and handling to somebody while they're in a psychedelic state?
Yeah. So the issue around bad trips is an interesting one because most of the time, if people, in a controlled setting, even a bad trip, I mean, what is a bad trip? For most people, a bad trip is like overwhelming anxiety and panic and disorganization and quite honestly, being in a bad environment. But it's pretty rare to have a quote unquote bad trip in the setting of like a therapeutic environment. Um, and so in terms of training around that, a lot of the emphasis that I've seen, and again, it should be said in all of this, like I'm still new to all of this. I've only been in this space a couple of years. I'm still trying to figure it out. So I am by no means, a complete expert. But from what I have encountered, the training is really about getting people to feel safe, feel comfortable. And the notion of a bad trip isn't as concerning as you would think. You're not doing it like at a fish show, where suddenly like things can go wonky real fast. In a controlled environment, it can be scary, and sometimes people may need a little bit of a medicine to help calm them down. But it's actually pretty rare. In what
I
I've
would
seen.
almost like, to me, the thing that comes up is almost like a paranoia that could occur if you like know that you're part of a like experiment and then
Mhm.
you're like on a psychedelic trip and it's like, oh, they're like observing me right now, you know?
Totally.
Um,
There is some self-consciousness that comes up for people, I think, when they're being observed. But that's why you have the preparatory session to really help frame what exactly is being done and to develop a relationship. You see, the psychedelics, and I think this is an important thing, the psychedelics themselves aren't the cure for anything. What more often is, in my opinion, the curative component is the relationship between the therapist and the patient. And so but the psychedelics just kind of accelerate that process, right? And so if you're in a safe relationship, the idea hopefully is that even if things get really scary or overwhelming, you trust the person you're with and you've had some time to build a relationship. It's not just like you're going to a room with a stranger and using these compounds.
yeah. So on this note, I mean, I assume I kind of know the answer in terms of whether this is possible now, but at some point, is like, what about the possibility of having your therapist go on the trip with you? Like, is that something? Because I've personally, I've been kind of like a guide for people when I'm going on the journey with them and when I'm not, and it's very different experiences. So is there kind of discussion of that in the academic research realm?
We're not there yet. No, we are not there yet.
Yeah.
Yeah, no, certainly in the academic realm, the guides are certainly not using any psychedelic themselves. Yeah.
And is there, while we're just kind of shooting off the random questions here, has there ever been like, as you were saying, your firsthand or your discovery of this started at UC Santa Cruz. So I assume that you've had your own journeys with these elements. I'm curious if there's ever been like a study on how that affects things. Like if psychedelics are just such an interesting thing where it feels like the people who have experienced them have a different outlook than the people who haven't. So it's almost like if you had two identical studies where one person running the study has that experience and the other doesn't, I'd be curious if that would have different results. Have you ever heard of any discussion about that kind of stuff?
There actually is a lot of discussion about this right now around to what extent is it important that the therapists have had firsthand experience on this psychedelic.
Yeah.
And there's a varying opinion. Just putting on my non-researcher hat and just as putting myself in the position of if I were a participant, I certainly would feel more comfortable knowing that the person in the room with me has had a similar experience than I'm about to have, right? I mean, just common sense would tell me, right, that I would feel safer knowing that you, as my guide, have had this experience.
Yeah.
So to me, it stands to it makes sense that people are going to want to be in the room with therapists who have had that sort of experience. So I think right now, I mean, there's lots of different opinions about this, but most of the people, I would say, have had some personal experience in this altered state of some form. For some people, it might just be meditation, or it might not necessarily be from psychedelics, but I would certainly say that most people agree that you should have some exposure to altered states of consciousness.
That makes sense. Earlier on, you mentioned that part of the reason that this was interesting to you was because you felt like there were kind of shortcomings in the existing options in terms of helping with addiction therapy and just general therapy. So what are some of those shortcomings, and where do you hope that psychedelics might be able to fill in some gaps?
I mean, the shortcomings are vast, right? We know very, very little about the human brain. We know very little about the mind. We know very little about addiction. I mean, we can't even agree on a definition of what addiction is for a lot of, there's so much unknown, I would say. And I think that where psychedelics could potentially play a helpful role in this is that from a treatment perspective, I do believe in the power of relationships, and I think the therapeutic relationship, I think that is an area where I have seen the most benefit for people. And I think, like I said earlier, psychedelics can really accelerate that relationship, and they can accelerate that, the work of therapy in a pretty robust way. I think for a lot of people, therapy is something that becomes a pain in the ass because you're going once a week, you're spending all this money, you're parking, and people just if they don't see results, they kind of lose motivation, right? But what I have noticed is that for people who've engaged in psychedelic psychotherapy, they see some dramatic changes pretty quickly. And so that motivates them to continue with the therapy. And so it becomes self-fulfilling, right? They're motivated, so they go, and then they go, and so they see more benefit, and then they keep going. You know what I mean? And it kind of feeds onto itself.
Yeah.
Yeah.
It seems like trying to do a study on something involving the human psyche has got to be really hard. It's like if you're talking about even something like, how does this affect someone's depression? It seems like most people, after they did a therapy session, are going to say, oh, I feel better, regardless of whether or not they do, just to be polite, So how do you actually figure out if you're having a positive effect or if the person's just trying to make you feel like you have a positive effect?
That's a good question. I mean, I think that's one of the reasons I really like working in addictions, because there's a very clear, are you using said substance or are you not? You know what I mean? There's a very, I don't want to say simple because it's obviously complicated, but there's a pretty simple outcome. You're right. Mood is a really hard thing to capture, right? Even the vernacular we use around mood is a really difficult thing. Everyone says, oh, I'm depressed, or oh, I'm feeling bipolar, or we misuse these terms. And so Um, you're right. It's a complicated interaction. As a psychiatrist, when I see someone who's depressed, I look at things like functional outcomes, like are you able to go to your job? Are you having meaningful relationships? Are you able to, you know, do your basic, get dressed, brush your teeth, like those sorts of things. Those are kind of the metrics that I'm using to see, are you able to live your life in some meaningful way? And that's absolutely an imperfect metric, but that's like the best metric that we have, I think, at this state. In terms of addiction, it is a little bit more clean. It's a little bit more simple. If you're an alcoholic, I don't want you to drink. Like, so, and there are ways in which I can measure that, right? I can like check to see if you're drinking. I can ask your spouse or your partner, or um, so that helps in some way. But you're right. I mean, the diagnostic categories that we use in psychiatry and in addiction are very imperfect. We don't even fully appreciate or understand what depression is and how to define that. And so it is very, very difficult. Where I find some comfort is knowing in looking at very concrete outcomes. And that's why I look at like behavioral outcomes, like addiction as like a nice way of approaching some of these questions. But you're right, it is exceptionally complicated.
Do you think that there are any like big misconceptions about psychedelics, or particularly like research involving psychedelics?
Yeah, there's certainly a lot of. I mean, their misconceptions are far-reaching, and it depends on the audience. I think some people, I was raised in the age of like the war on drugs. Just say no. This is your brain on drugs. Like that's the generation I came from, and so I think a lot of people, when they hear what I do, they're like, "Wait a minute, you're giving drugs to treat drug use? Like that seems weird." And so that's a huge challenge. And I think part of that is stigma. People think all drugs are the same, like cocaine, opiate, psilocybin, LSD, they're all bad, right?
Right.
And so that is definitely a huge challenge around that stigma, and helping people understand that all drugs are not created equal, and that all drugs have, potential benefits and potential risks. On the flip side, if I talk to a hardcore psychedelic evangelist, of which there are many in this region, I have a lot of concerns about safety. Like there's a lot of unknowns, and I don't think psychedelics are a cure-all for everything. And I do worry a little bit about people kind of fetishizing the compounds themselves. These are not cure-alls. You still got to do the work. You still have to have the relationship. You still have to like, I'm not going to just take LSD and that's not going to wipe away the suffering and pain and all the years that I've accumulated over years and years and years. And so I also think we need to temper our expectations a little bit and recognize that psychedelics are catalysts for change, but they do not themselves create the change. So those are probably the two biggest things that I come up against in terms of kind of the challenge. In terms of research, I would say that a lot of people think that I'm trying, again, it depends on the audience. In Seattle, oftentimes, among the hardcore psychedelic community, when they hear I'm academically affiliated and trying to do this research, there is a suspicion of like, oh, I'm trying to make it into like big pharma. I'm trying to standardize it and make a buck. And I mean, that's just like ridiculous, because I'm certainly not. I mean, there's very little financial incentive for me to do this work. I'll tell you that. And I'm a believer that like we need research to help drive practice. So yeah, so, there's lots of different opinions about it, but I would say the biggest one is probably the drug use. You want to give drugs to treat drugs. That's like a big one that I come up against a lot. Yeah.
Yeah, well, there's certainly a big difference between different types of drugs.
Yeah.
There's no doubt about that. Let's see. Are there any consistent like themes in what you've seen working with patients in terms of their takeaway with psychedelic therapy experiences?
Yeah. Themes. That's a good question.
Or is it just really personal and there's not really?
No, I mean, it is. I would say both are true. It is personal, but I would say for a lot of people, I think what a lot of people feel or are struck by is the sense of like wonder and awe. And for people who have not experienced that, that can be really intense. And some people may call it a spiritual experience. Some people might call it a sense of connectedness. But that is definitely like a universal thing that most people, walk away from. The language may be a little bit different based on your background, but that sense of connectedness, that sense um, of awe is something that I'm very interested in and I find very fascinating.
In in terms of before you were speaking about how there, because it's a Schedule One drug, it can't get any federal funding. Are there other complications that arise from the fact that it's not federally legal, or is it made easier because I know like Seattle recently, I think
Yeah.
decriminalized. Does that have an impact on you on the research side, or not really?
No, unfortunately not. I mean, the argument can be made, um, you know, decriminalizing, um, I think, is a move towards increasing the conversation around the use of psychedelics. So in that sense, there's kind of like a peripheral benefit, right? Of like, oh, it's in the news, people are starting to talk about it. Like, why are we decriminalizing things? It goes to the point earlier of separating out in people's minds that you know, mushrooms are very different than cocaine, right? Or mushrooms are very different than heroin, right? And I think to that extent there is some benefit. Um, the funding thing is a big issue, and hopefully that's changing. There is movement right now. There are some grants that are starting to come up. I think that there is pressure to slowly change the funding strategies right now. Um, but I would say that's probably the biggest barrier that we really face is the funding issue.
Do you think that do you think that psychedelics help people actually get to the root of their issues, like when they have these like healing sessions? Do you think that it's actually like helping them dig into the root of their issues, or is it sometimes just, I guess, amplifying whatever signals currently going off in their brain? Because sometimes I wonder that myself, like, because I feel like I've had both experiences. I
Totally.
guess.
So I think that question highlights the value of the therapeutic relationship, right? Because I use this example a lot with people where I'll say, a lot of people have done psychedelics recreationally, and yet they still struggle with a variety of mental health concerns. So certainly, it's not the substance alone that's curing anything. Otherwise, everyone who's ever done psychedelics wouldn't be struggling with depression or addiction or sadness or whatever you want to call it, right? Um, so I think that no, I don't think the psychedelics get to the root of the problem inherently. I think it's an opening. I think it's an opportunity for you to maybe sit with some sadness or fear or emotions that you've kind of walled off and you've hidden from yourself, and you've probably spent a lot of energy like compartmentalizing those. I think psychedelics give you a road into that, but you still got to sit with it. It's still uncomfortable. And that's where the therapeutic relationship is really important, to have that support afterwards, to kind of make meaning from that. And I think that is where you start to get into the root of it, if you will. Does that answer your quick question?
Yeah. In an ideal situation, if like let's say this got to the point where we had a bunch of successful studies, it started to become popularized, and psychedelic therapy was more commonplace. Let's say it's just another tool in a therapist's belt that they can choose to use. What do you think would be a signifier that somebody that they're working with might be a person who could benefit from that type of therapy? Do you think that there are signs of like, oh, this person would benefit from this, or this person shouldn't do this?
Yeah, I mean I think that's a big question that we're trying to answer right now. Like who are the people who are going to benefit the most? And I think right now we're still at the early phase of how do we avoid harm? So right now, for example, if you wanted to do a psychedelic study, people you want to avoid are people who have a history of psychotic disorders, people who have a strong risk for psychosis. So like a first generation relative who has schizophrenia or bipolar disorder, and that's not, the evidence for that is actually pretty weak, but out of an abundance of caution, we try to avoid people who we are concerned. I mean, you can think about it like this. There are people out there who exist in this world and are maybe they are a little bit leaning closer towards uh, a psychotic state, right? A disorganized internal state, but they're able to kind of manage and get through the world. Psychedelics are an incredibly stressful experience. And so for some people who can't tolerate that burden of stress, that kind of psychological stress test, if you will, those people we want to avoid. So I would say that's kind of where we are right now in the knowledge. theoretically moving forward, I think there's so many unknowns about who would benefit. I mean, just anecdotally, and this is not data driven at all. So don't quote me on this and then email me that I'm a jerk. But you want. I think it really depends on what it is that you're trying to treat, right? If you come to me and you're depressed, and you've been depressed your entire life, and your parents were depressed, and your grandparents were depressed, and there's like a strong, like potential kind of biologic explanation, well, I'm going to be a little bit more cautious about using psychedelics perhaps. Whereas if your depression is maybe what we would call a reactive depression, like you've had a lot of grief, you've had a lot of loss, you've had trauma, right? In our current limited understanding, in my current limited understanding, that would be someone that I would be more excited or interested in experimenting with psychedelics for, because I think that's where you can find some traction for, particularly people with trauma, to help them understand and sit with that discomfort. I think that's where I feel more comfortable using psychedelics in that kind of patient population right now. But again, we are at the infancy right now in terms of what we know.
Yeah. Since you started making this kind of your field of study, has there been anything particularly surprising that you've learned?
I mean, I think what's surprising to me, yeah, I would say the thing that surprised me the most is the difficulty of walking the line between being an advocate and being a researcher, right? I mean, me as a non-academic person, I think that psychedelics should be available, and like the fact that we criminalize it is absurd. But I have to walk a careful line, because I also can't be seen as a psychedelic evangelist who's just trying to get some psychedelics out in the world, right? I have to be seen as someone who's trying to think about this rationally and scientifically. And so I've been a little bit struck at the difficulty of teasing those things apart.
Yeah.
And it's been a little bit more complicated than I originally thought, particularly as it is a political issue right now, right? I mean, we're seeing, like in Oregon, we had legalization of psilocybin for medicinal use. We just had a bill here in Washington that didn't pass, that just came up. And I think, psychedelics are kind of modeled right now legally after cannabis, and they're trying to like go state by state and see if they can kind of expand. So it does put you in this weird position as a researcher, because of course I think that we should be studying these things, and I don't want to undermine my research by being seen as someone who's just like an evangelist. You know what I mean? And to be totally fair, I don't think everyone should do psychedelics. Like, I don't think we should just be dosing everyone left and right. Like, I think we should be doing it thoughtfully. These are powerful compounds that, while the harm is minimal compared to other substances, there is still harm that's done. People make bad decisions. People do dumb things. They try to fly and jump off buildings, and there are bad things that can happen. And so I also, I feel like I walk this weird line between advocate and researcher in a way that I didn't expect.
Yeah, I can imagine that could be a little confusing at times.
It is a little confusing. It is a little confusing.
Just taking one moment to look over my notes here. Well, I think this has just been really fascinating overall. I think you've done a really good job of answering most of the questions that I had off the top of my head. Is there anything else that you feel like I missed or that you'd like to discuss while we're here?
No, I mean, I think your questions are good. I think, I think the bigger challenge in all of this discussion is that there are so many unknowns around mental health and addiction, and so there's like layers of complexity and misconception that we need to start to peel back. Even this idea of addiction is like something that is not universally understood, right? Some people still think it's like moral character failing. Other people think it's purely biologic. I think the truth is probably there's lots of different ways in which addiction can emerge. There's lots of different ways depression can emerge. And we have so much to still understand and discover. I don't know. I think there has to be a lot of humility in this work, because the more I learn, the more we realize we know very, very little. We know very little, which is also exciting. It's also a cool opportunity. Like, we get to explore at this frontier of the brain which is cool. I mean, that's one of the reasons I got into psychiatry. That's one of the reasons I want to get into psychedelics, because it's like there's so much to learn, which is really fun.
Yeah, it's definitely a fascinating subject. I really appreciate you taking the time.
Yeah, my
Do you have
pleasure.
any resources that you would recommend for people who want to learn more about this, or any plugs? I don't know if you like to have an online social media presence or
Yeah,
not, but
I actually don't have an online social media presence. That's part of the advocacy versus researcher where I go. So we are developing the Center for Novel Therapeutics at the University of Washington. For people who are interested, you are welcome to reach out to me. And we need donations, we need money, we need resources, and I'd be happy. People can email me, and yeah, you can reach out to me directly if you want, and we can have a conversation.
cool. Well, thank you very much. I
Yeah,
really appreciate you taking the
my
time.
pleasure.
This was fascinating for me.
Yeah,
So
cool.
thank you.
Right on.
All right. Thank you guys for watching. Thank you to Nathan for letting me pick your brain on this subject. I hope we get a chance to do it again sometime. If you enjoyed this conversation, let me know, okay? Leave a comment, hit the thumbs up button, or subscribe to the channel. It really means a lot to me. I have some more great interviews coming up for you soon. So, yeah, keep your eyes out for that. Until then, have a great one.